Good afternoon. I would like to thank Rebecca and the entire team at McKesson Canada for welcoming us here today. It's great to be here with General Hillier and the Solicitor General. We just had an amazing tour of McKesson's warehouse here in Brampton. They have this impressive facility and another one in Trenton. They employ 140 people here and 7,000 across the province. In this 115,000 square foot warehouse alone, there are 9,000 different prescriptions. We're here today because this is one of the many conversations we're having about the rollout of the COVID vaccine next year. As General Hillier has said, we will be ready by December 31st. But we know this is going to be the largest logistical undertaking that we've had in Ontario in a generation. We have to get this vaccine to every corner of this province. It's no small feat, and we know we can't do it alone. We need the help of businesses and people with the necessary expertise in logistics, technology, patient care, and pharmaceuticals. We will be leveraging the expertise and resources right here in Ontario from both the public and private sectors, who already play an important role in supporting the storage, distribution, transportation, administration, tracking and monitoring of pharmaceuticals, including vaccines, in the province. These partnerships will be essential in supporting the province's large-scale logistical efforts for Ontario's COVID-19 vaccination program led by General Hillier. As of yesterday, we started speaking with vaccine manufacturers, including AstraZeneca, Pfizer, Johnson & Johnson, Janssen, Moderna, GSK, and Sanofi. This is absolutely critical for planning. We're working with distribution experts like McKesson and Shoppers Drug Mart, who not only have the warehousing capacity for vaccines like this, but they also know how to get these vaccines to their networks, including hospitals and other frontline care providers. McKesson has been getting ready since September to support the rollout of the COVID-19 vaccines. We're also speaking with companies like Purolator to understand logistics. By working with these industry leaders, our federal and provincial partners, and the experts of our task force led by General Hillier, I am confident that we will have one of the best rollout plans in the country. We will deliver the COVID-19 vaccines when they're ready, we will deliver them where they're needed, and we will deliver them as quickly and as efficiently as possible. So thank you very much, and we're pleased to take any questions you may have.
First question, please.
And comes from Laura Stone at the Globe and Mail.
Hi, Laura.
Hi, Minister and General Hillier. I was hoping you could provide a few more details about this plan. Firstly, who is the government planning to prioritize with vaccine distribution? Is it healthcare workers, long-term care residents, vulnerable populations? Who is going to get the vaccine in Ontario first, and how are you assessing that?
We are working on that right now. There is a task force that's being assembled. One of the people on that task force will be a bioethicist who will help us make those determinations, but I think it's fair to say that we want to make sure that our most vulnerable residents are the people that we want to protect. And of course, we want to make sure that our frontline healthcare providers can continue doing their excellent work. So we are discussing the priorities now, but we will have that ready in very short order, because we don't have a lot of time for this, and we want to make sure that we're going to be ready to go as soon as those vaccines land in Ontario.
Follow-up?
And when are you planning on making the list of those involved in this plan public? I mean, General Hillier has said that you'll be ready by December 31st. It's now December 1st, so like you say, there's not a lot of time. Are you planning on making that public? And can you share a few more details on how you're planning to distribute the vaccine? Is it through pharmacies, doctors' offices, assessment center type facilities? and you're at a warehouse today, so are you planning on storing the vaccines in warehouses? Can you just give a few more details on what your rollout plan is here?
Well, we will be making the names of the task force members public. We should be able to do that in the next very short while. General Hillier also has a secretariat of a few people that are working with him. And then in terms of the distribution, that's going to be determined based on the priority of people who are going to be vaccinated, and then depending, of course, too, on the type of vaccination. As you know, the Pfizer product has to be stored at minus 80 degrees, and so that's going to require delivery to places that have those freezer capabilities. Some of the other vaccines don't require that level of temperature coldness for the vaccinations, and so there will be different priorities and perhaps different places as to where they will be delivered. So we're working with all of those issues right now. Perhaps General Hillier would like to speak to perhaps some of the issues relating to the distribution and the task force.
Minister, thank you. And just to pile on, I guess, on the prioritization, obviously that's the decision of the leaders of the province of Ontario to make. Clearly, I think we're all agreed that the most vulnerable of our population who get hit first and worse by this terrible virus are right up there. And secondly, those healthcare workers who are obviously often in close contact with people who have COVID-19, therefore run a higher risk of catching it, therefore run a high risk of retransmitting it, are right as the top number one and number two priorities. It's easy to say that, but when you operationalize it and bring it down to you have 50,000 vaccines and you have them available on this day, then you want to be very careful. In some cases, those two priorities I think will probably go together. If you do, for example, a long-term care home, it would be silly to me, it seems, to recommend anything else than do the people inside that can be vaccinated, plus the care workers who go in and out of that home each day. And so I think those things will resolve themselves. We want to be ready by 31 December, yes, but we also know that over the next 2 weeks, we're going to do the bulk of our work in getting ready, and then we'll have the details that you've just asked about. When you talk about storage in a facility like this, let me also say thank you to Rebecca and Dimitri and Renee here, and most importantly, the 140 people, 150 people that work here for the incredible work that they do. This is an awesome facility and confirms for me just what private enterprise and private business in Canada can do so well. And all of a sudden, I don't worry about the distribution of a vaccine across the great province of Ontario, because these people do this every single day. And you know, one of the things that we got from this was that every day from this facility, somebody reaches out to with a delivery or a shipment, every single pharmacy and health unit in Ontario, every single day. And so I don't worry about the distribution anymore. The storage of the vaccine, I think we'll be able to move the vaccines almost as quickly as we get them so that we don't waste any time between arriving from the producer to going into the arms, being thawed and prepared and going into the arms of those who are waiting to get it. And it seems to me we'll always have more people wanting to get it in those first two priorities than we'll have vaccines for in the first quarter of 2021. And so we're launched. We got a lot of work going on. We're going to wrap up a lot of that stuff in the next 14 days because we want to be ready, and then we want to exercise that we're ready, and then we want to actually be there to do the job no later than the 31st of December. Thank you.
Next question.
Next question comes from Brian Lilly at the Toronto Sun. Please go ahead.
Hi, Brian.
A question for Minister Elliott and for General Hillier. The federal government was just providing their update on vaccine rollout. And while they said there's a lot of misinformation out there, that Canada is not at the back of the line, that we're well placed, when pressed by reporters multiple times on how soon after Health Canada approval we could get a vaccine, the clearest that Minister Anand could give was sometime in the first quarter. How does that affect your planning, your sense that we are on the right track with this vaccine? Do you have confidence in how the federal plan is rolling out and how it will impact your ability to plan at the provincial level to actually deliver the vaccine to local hospitals, doctors' offices, long-term care facilities?
Well, it is critical that we have that clarification as soon as possible because we need that for planning purposes to know what volumes of the vaccines we'll be receiving and when. But as the Premier has said before, that we are taking the Prime Minister at his word, that we will have the vaccines very early in January. But we will be seeking further clarification. I'm working very closely with Minister Hajdu, and I believe that General Hillier is working closely with his counterpart in Ottawa, but perhaps the General Hillier would like to make comments on this issue as well.
Well, I think as the Minister has said, we don't control when the vaccines arrive to us and when they're approved by Canada, so we wait to hear that. If it is not till the first quarter of 2021, number one, that gives us more time to prepare to make sure we're absolutely ready, and we got a million things that we want to get done. But number two, I think this is hugely important for the success of the vaccination program in Ontario and of course across Canada, is that other people, other nations, perhaps the United States of America, are going to be administering those vaccines before that. And although we'd like to have them early, if we don't, we do get an incredible opportunity to learn from their experiences in front of us and to learn what they're doing right and to make sure that we're doing that in our vaccination program and operation. And if they're doing some things wrong, make sure we can improve on it so we don't make the same mistakes. And we want to tie ourselves in tightly to some of those programs that come in front of us. But let me use this and just digress off to a point I really want to make. And I kind of speak generally to people across Ontario, but I was not just in. You know, it might be into the first quarter of 2021. We don't know that. We'd all like it for the vaccine to be here tomorrow, to be 100% effective, and everybody have it on the day after. We know that's not going to occur. We know that the people, the men and women of Ontario, they're tired. They all want to get back to a regular life. They want their families back into a regular life. They want the economy to restart, and they want to get back into the schools and not have to worry about all the things that frighten us right now. And I'm just the same. I'm no different. I'm tired. I want this to be over with. And we know it's going to take a while. And we know that we can do this, right? And while we're doing it, and while we're getting through the period waiting for the vaccine, we got to make sure we keep using those really excellent social practices, wearing your mask, washing your hands, not touching your face, staying away from me, staying away from everybody else, and stay home unless you really have a need to go out, and make sure we don't spread COVID-19. Use the testing that's available if you have worries or fears or concerns, and meanwhile we'll grow the vaccine up the middle and get back to that normal society as quickly as we possibly can. And people are tired and say, oh my goodness, we can't carry on. Well, guess what? You can. This is not the first time in our history Canadians have faced those incredible challenges and gotten through them. Just think of the Canadians who went to World War I and faced the first gas attacks in April of 1915 and stood tall when the British and the French on their flanks ran and let the enemy come on through. Canadians stood tall through that incredible, frightening, lethal and stressful period of time. They stood tall at the Battle of the Somme, went up Vimy Ridge and did something no other nation could do and survived the terror of Passchendaele. And that word still, I think, evokes fear and disgust at what mankind can do to each other. And they were the same Canadians, their sons, their daughters, who won the Battle of Britain, who won the Battle of the North Atlantic, who went ashore on D-Day and fought in Italy to throw off the yoke of Nazism. They fought in Korea to do the same thing, and they continued that fight in Afghanistan. For us as Canadians, those were incredibly frightening things, horrible things, and they succeeded. They can do that. They can storm the beaches of Normandy. We can sit on our couch, stay away from everybody else, wear our masks, wash our hands, not touch our face. We can do that for the next months until we get the vaccine working through. Thank you very much.
Follow up?
Minister, there is a meeting with the federal government next Thursday, December 10th, to talk about increases to provincial health transfers, and that's been an ongoing concern for your government, for provincial governments, premiers across the country. Were you surprised that there was nothing in the fiscal update yesterday hinting that the annual increases, not the COVID increases, but the annual increases, were going to be considered, looked at, funded at the first time that we've seen an update, a budget in just about 2 years?
We were somewhat disappointed, yes, because we know that we need an increase in the transfer to the provinces. I think all of the provincial leaders are aligned on that. We certainly need it in Ontario because we are working forward. Our increase is getting smaller and smaller from the federal government. We want to get it up to 35%. And so we will continue to look for that. I'm sure the Premier will continue to advocate for that at the First Minister's meeting. And while there were some encouraging signs, some money going into developing a rare disease strategy as well as for some money for long-term care, we really need that substantive increase in the total transfer package for Ontario to be able to continue to provide all of our residents with excellent quality health care.
Next question.
Next question comes from Randy Ratt at CHTV.
Hi,
Please
Randy.
go ahead.
Hi, Minister. The most definitive thing that I've heard the Premier or the Prime Minister say about when people would have the vaccination in their arm is that the majority of Canadians would have it by next September. By majority, I take him to mean 51%. What percentage of people in Ontario need to have this vaccine before we can return to any sense of normalcy?
Well, we're looking at the figures that have been presented by the federal government. But as you know, the first two vaccines, the Pfizer and the Moderna vaccine, can only be given to people who are over 18 years of age. So we will need to hopefully have a vaccine soon for people under age 18. But we want to have the majority of Ontarians vaccinated, those who are able to be vaccinated. And that's another one of the challenges that we're facing right now, is taking a look at people that have physical comorbidities, whether they will actually be able to receive the vaccine. So it's difficult for us to say a specific number right now because we need to gather that further information so that we know how many people will actually be able to receive the vaccine.
Follow-up?
We've had a conversation many times about people in healthcare settings, frontline workers, making flu vaccines for them mandatory. Has there been any thought given to making this vaccine mandatory for people that work in jobs that would require it?
No, the Premier has been very clear that he wants this to be a voluntary assumption, that people will receive the vaccine voluntarily. We don't want to make it a mandatory requirement.
Next question.
Next question comes from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Minister. Just wanted to, sticking with the vaccine, get on what the protocol will be for people once they have their shots, since some people will have them and others will not. So, for example, could a family where everybody's had their shots, both shots, could they get together with another family that's had the shots and not pose any risk? So what can you tell people about the protocols, what the protocols will be for people once it's out?
Well, I would say that we're still working on the protocols. We're still working on the logistics of delivering the vaccine to people, but there will be many other issues that will fall from that, including what will be presented as evidence that you've had the vaccine, and then look at how do we reopen society up again when we've had a sufficient number of people vaccinated. So there are many, many issues involved in this. That's why we are receiving advice from companies like McKesson and other people who are specializing in logistics and other issues, including the bioethicist that's going to help us with determining the priority population. So I'm not able to answer that question yet. I think there are many issues that we still have to work through, but we're getting the team together to be able to do that.
Follow-up?
Okay, and I'll switch gears back to the hospital situation. The numbers are up quite a bit today in hospitals. 27 more hospital patients, 17 more in intensive care. These numbers seem to be going up a lot, especially on the critical end side. And I'm just wondering what you are hearing the latest on what is happening to non-emergency surgeries and those things that start to get pinched, because we're getting close to 200 people in ICU.
Yes, you're right. We are getting close to the 200 people, and we know that there are some hospitals that are in the hot zones that are already having to shut down somewhat their non-emergency procedures, getting back to the procedures and surgeries that were postponed during Wave 1. Scarborough General is one of those hospitals because that's part of Toronto and they're in lockdown. So we're following this very carefully, but we have brought a plan forward. Part of our major parts of our fall preparedness plan was to make sure that we had the capacity in our hospitals to the ability to continue with these surgeries, because we know that as tragic as it is to have lost a loved one to COVID, it would be equally tragic to lose someone because of a cancer surgery or a cardiac surgery that wasn't performed in time. So we have planned for that. We have another 3,100 hospital beds available that have been produced since March to be able to handle these extra volumes of both COVID patients as well as patients that are recovering from surgeries.
Last question.
Last question comes from Lorenda Reddicook at CBC News. Please go ahead.
Hi, Lorenda.
Hi there, Minister. The Liberals were bringing up in question period today a long-term care home in Ottawa where they say that 120 of the beds are not occupied and they are single-bed rooms. Is the government looking at doing something to try to change this type of situation?
Well, yes, we are. Absolutely. We want to make sure that all of our long-term care beds are occupied where it's safe to do so. And so there is an agreement with long-term care homes and hospitals as well, that each one is paired with another, so that if there is an outbreak in a long-term care home, that patients can be transferred to hospital, and we don't want to send those residents back to the long-term care homes until it's absolutely safe. So that's probably a situation of that nature in Ottawa, where they are trying to decide whether it's safe to send the residents back home or not.
Follow up?
The next one is from our colleagues in Windsor. They say that that region is dealing with surging cases and many outbreaks, and the city's medical officer of health says that public health there is strained and risks completely collapsing if the case rates don't get under control. So is there more help for that region coming, and are you considering moving Windsor-Essex to a lockdown?
Well, we just moved Windsor-Essex into the red control zone, so we certainly recognize that there's an increase in cases there and that there need to be more restrictions in order to prevent greater community transmission. But we will stand ready to assist the public officers of health and the medical officer of health in Windsor-Essex with whatever supplies they need in case they need more assistance with contact management. That tends to be the situation where you have greater transmission in the community. So we will certainly provide them with that assistance, because we want to help them get their area under control and reduce the spread, get the number of cases down so that they can be removed from the red zone and go back to orange or yellow or perhaps green.
Thanks, everyone.
Thank you.